Well, welcome to another episode of Mind Your Mouth. My name is Melissa Mugno, and I am your host, and I am so excited for today's guest. Without much further ado, I'd love to introduce my friend, colleague, Dr. Piya. Hi, welcome.
Thanks, Melissa. Thanks for having me. Super
How-
excited to be on the podcast with you.
Yeah, I'm so excited to have you on. As always, this podcast, I tell all the guests, we're just having conversations, hopefully with people you already know, but doing it a little differently. So let's chat about all things going on in your life. What's up and what's new in your world? I know you got lots of stuff going on. I kind of wanted to jump in a little bit about your new residency.
Oh, yeah, sure.
Yeah.
So I just joined the Airway Health Solutions team, and I am going to be kind of hosting and kind of taking on their tongue tie piece of education. As most people know, Airway Health Solutions has been doing a lot of education in the expansion space for children and adults for a long time. But as you know, we can't ignore muscle function. And specifically, I'll be teaching on how to diagnose and treat tongue ties in infants and children. And so it's a space that I have been in. Actually, that's where I started my quote unquote airway journey.
Yeah.
Was really in the tongue tie space and then kind of moved on to expansion and all the other things. So I am very familiar with tongue tie treatment. Both my children had tongue and lip ties, and that's kind of what brought me into the space. But I'm really excited to be adding this to their curriculum because I don't think that airway treatment is complete unless you're looking at all the things, particularly muscle function and supporting tongue posture. Because if we just do expansion and appliance therapy and then don't address muscle function afterwards, it's really not successful long term.
So the only reason I wanted to start there was because, education is one of those things a lot of us drop into. And I've been getting a lot of feedback. Well, like everybody that every doctor or whatever, like everyone drops in, starts doing education. And I was saying to them, well, it's because we have such a need for it, right? Like it's kind of a lacking space, which I love that you touched on there, like your beginning of your journey. And I totally want, I always want the listeners to see a different side of everybody when they're on here. But, your girls were a really big part of how you even entered into this space, right? I mean, I know you openly talk about that. So yeah, let's go there a little bit, right? So let's go early into this, into your early beginning. Why did you even have to start practicing like this?
Yeah. So, it's everything happens for a reason, right? I believe like the universe takes us on some journey.
Mm-hmm.
And even professionally, like I started out as a general practice dentist, had an inkling towards like pediatric care, and then finally decided after I had my older daughter, Syra, who's now almost 13, that I wanted to go back to pediatric residency. And when I entered pediatric residency, by no means did I think I would be practicing like functional airway pediatric dentistry on the other side. So I went through residency, and at the time, Syra was about 18 months old when I started residency. But when she was born, I had like all of these issues with breastfeeding, and her dad and I used to call her like the noisy baby because she was just always unsettled. And that is all we knew, right? And I had all these goals as a first time mom, how the first year of life would go, and like none of it went that way. And you go to who you think are the experts, the pediatricians, the lactation, and it still is this way, kind of the luck of the draw. Like, do they know about these things or not? Whose hands do you end up in? And in my case, as a general dentist, I knew nothing about tongue ties or anything at that time. And neither did any of the people that I went to try to get help. And so Syra bottle fed and, was doing well because she was gaining weight. And we just kind of chugged along with life, eventually forgot about the fact that she didn't breastfeed, whatever. So I was in residency, still 2 years, didn't learn anything about tongue ties or muscle function or breathing or anything. Towards the end of my residency, Syra started having these like epic meltdowns every single day. She was audibly snoring. And at least in residency, I'd learned about like ENT things, tonsils, adenoids, a kid that like wasn't sleeping well because of those types of obstructions.
Okay,
So
so that is something they do touch on. They'll
they
talk about
do,
that?
they do.
Okay.
Like adenoid facies is like, a kid that the classic signs of a kid that has that have large adenoids. Essentially, they have airway obstruction, right? It's every kid we look at, the venous pooling, the mouth open
Mhm.
posture. But the only thing they really teach that it's related to is enlarged tonsils and
Tonsils.
adenoids, which we know is related to a mouth breathing child
Yeah, which
because
is a
they're
side
taking in
effect.
all this unfiltered air and it's hitting the tonsils and adenoids. So,
Yeah.
they don't go to the root of it, which is the mouth breathing issue. They just go to, what we've seen as now the downward effect. So I knew at least that. We ended up taking Syra to an ENT, and her adenoids were so large that she was 90% deaf out of her right ear because she had so much fluid back up. So we did the things. We took out the tonsils and adenoids. But again, like so many of my patients, yeah, the audible snoring sound went away, but nothing else changed. Right.
Mhm.
And so at this point, I had taken a course by Dr. Zaghi because I was like, looking into all of this. I bought a laser. I knew I wanted to open my own practice after residency. So I bought a laser and
'Cause
this was
you bought the
2017.
laser. You did it kind of a little like you bought the laser first, and
Yeah.
then
And
you kinda went down.
I bought a BioLase laser. I was
Okay.
opening in an area of Houston that was pretty saturated with pediatric dentists.
Mm.
But nobody was doing laser anything. So I was like, let me buy a laser, you know?
Yeah, try to
So I
just
bought
you find your
yeah,
niche
I
in that
bought the
area.
BioLase because I thought, okay, I'll do some like hard tissue dentistry with it and maybe let me look into this tongue tie thing, right? So I go to Dr. Zaghi's course and he is talking about a kid that has airway disorders, not sleeping well, tongue tie, and literally like Syra was checking every single box. I mean, it was just,
Mhm.
I started crying during the course because I was like, how did I miss this? Well, I know how I missed this because I wasn't taught anything about it. Right.
Yeah.
So I went home, of course, looked in Syra's mouth, tongue tie, lip tie. But, you know, myself as a practitioner in 2017, I was not taught about myofunctional therapy and interdisciplinary care and looking at, the palate and all these things. So I just took my BioLase and I lasered her tongue tie and lip tie, thinking, oh, this is this is gonna work. But
This is easy. Yeah.
it's kind of like the tonsil adenoid removal. You can't just
Mhm.
like remove things and think then function is gonna get better, right?
Yeah.
So again,
Which can we just stay there for 1 second just for, parents or anyone that's listening that's maybe outside of our professional space, is that, I mean, someone might have a technique to do it, but if they don't really understand the why and the deeper root issue, it's really a Band-Aid effect, right? Like it's
mhm,
just all you're doing is kind of snipping. I mean, right, what do you say to parents that are saying that are like, "Well, why can't you just cut the tongue?"
yeah, I mean, the tongue is a very complex group of muscles, really. And every muscle has habitual movement. And if we don't retrain that habitual movement or strengthen the muscle, is not going to perform the way we want it to. I mean, I always equate it to like going to the gym. Like
Mm,
if you're just sitting in the gym and not actually working out, like nothing's going to change, right?
yeah.
So, you can buy the cute gym outfit and the shoes and go sit in the gym and nothing's going to change. You have
You
to
buy the treadmill and you
actually,
can hang the clothes on it.
yeah, you have to actually exercise the
Yeah.
muscle to
Mhm.
get it to change. And so, but that is just the way our medical and dental curriculum is. It's very linear, it's very procedural focused. And this was a big learning curve for me. And I experienced it with my own child, but then also with the initial patients that I was treating for tongue and lip tie is that, yeah, sure, some people just with the procedure will improve, but that's almost like it's not predictable. It's kind of like a fluke, you know?
Yeah.
And so if you want to make it predictable and really root cause and long-term better function, you have to look at the function. It's all about the function. So what I see a lot of practitioners do is just look at the anatomy to determine whether something's a problem or
Yeah.
not. But
Mhm.
the goal is better function. So if we're not looking at the function initially, how do we
How do you
know
know?
where
Yeah.
where we're going and what the end goal is, right? So to me, if you're not looking at the function, you're underdiagnosing or overtreating or a combination of both because you're not getting the full picture. And so
Yeah.
again, for me as a mother and a professional, I had to take a step back and say, you know what? I really actually need much more education before I really make this part of my practice. Because with Syra, again, released her the first time with no functional, really in-depth training or, collaboration. And it was like the ENT thing. Like she got a little bit better, but like we still weren't where we wanted to be. Right.
Yeah.
So then I went and did a lot more training myself professionally. I shadowed a bunch of myos. I took courses with SLPs and myos and chiros and really just tried to learn like the big
Big
picture. And
picture.
it was huge for me because, also as a doctor, like we're not told like, hey, go learn from a therapist,
Yeah. Well,
go
and
go
also,
learn from someone that's not a doctor
yeah, I was
about
just
the
gonna say, and
things.
just for people to know, your ex-husband, Cyrus' dad, is also a physician, right? Like, I mean, you're
Yes.
both right. So we have both parents that are, very educated, very much, and he's a traditional, right? He's a
Yeah.
primary care or
Emergency medicine.
emergency medicine. So comes
Yeah.
very much from that traditional mindset, right? So for both of you, I always say like it's interesting from the dentist, but also the other parent, like, what is he thinking from his perspective? Like what all these
Well,
things
for
are
him,
happening.
he didn't even want to initially take her to the ENT. The only thing that convinced him was that we went on vacation and she kept him up all night snoring.
Really?
And
So
he was like, oh, well, when I told him, I said, she's having tantrums. I can hear her snoring. It's not normal. It was a response that we get from a lot of physicians. Oh, don't worry, she'll grow out of it.
hmm.
It's not a big deal.
Which doesn't, I mean, this is his daughter who he loves very much and
Yeah.
think, right, that's not him trying to dismiss her symptoms. That's what he trained and believed.
Well, and that's the issue that we find not just with the physicians, but with other dentists. It's just like if we didn't learn it in school, it doesn't exist or
Mm.
it's not a real thing or, and the problem is our curriculum is not keeping up. Right. And it takes so long for curriculum to change because there's so much red tape in the way. And
Yeah.
this is where the programs that we educate with, this is where we come in because there is such a gap in education. And yeah, the ADA, the APD, they're starting to talk about this and host things, but it's still not in the schools.
Well, right. Doing the podcast has been a lot of fun because I've been blessed to have so many great people on and we're just having on things. And there's like this mixed view. Some people will say we've made so much progress. And
Yeah.
then there's others that, depending on what conference they just left or what conversation they just had, they'll be like, oh, Melissa, it feels like we took, 6 steps back.
Yeah.
And I'm like, it does depend on what group you're, focusing on. I think you and I are in a similar space. I choose to where my mind goes, my energy flows. And like, I'm like, we have made a lot of progress. I mean, from when you and I first
Oh,
met to
yeah.
today,
Yeah.
but the fact that we don't discuss anything in school systems, nothing, no one's getting screened for it. I mean, that's a massive disadvantage.
I also think it's interesting. Like I practice near where I went to residency and I have offered to give free lectures to the residents and no one's interested.
No one's
And
interested.
that to me is like so interesting.
Do you think they're not interested because, the one area I mean, even like with JJ, with my own son, like there's no perfect outcome, right? Like, I mean, we could go back and talk a little about Syra. Like, JJ's night and day better than he would be if I did nothing, but he still struggles in areas. He might even need
Yeah.
expansion again. And
Yeah.
I'm blessed that I know that I don't look at it like it failed. It's just he needs more, right? Like
Yeah.
he needs more. But I feel like in the medical community, I don't know, that's my take. What's your thought? Like, why do you think they don't want
Well,
to
fr-
lecture?
from a dental perspective, we teach things that fail all the time. Crowns, fillings, things that have to be redone, that
Okay.
a tooth abscesses after we put a crown on it. We still teach how to do it. Nothing in medicine or dentistry is 100% ever. I
Well,
always tell
this is
parents,
a great conversation because
I
people
always,
because what's
I always,
the thing is show me it works, prove it. I'm
yeah.
like, what do you
Well,
mean?
I
Prove
always tell parents if a practitioner guarantees something 100%, they either haven't done enough or they're just lying to you because we cannot, it's clinical practice. We are dealing with a human body. Every human body is different. It's going to respond differently. We can get all the information that we have access to, but we're never going to know all of it. A great example is a dental radiograph. It's a two-dimensional image. So if I see a cavity on an x-ray and I'm going to go in a three-dimensional space and treat it, I am not seeing everything. I don't have a microscope to look at every tubule on that tooth, you know,
Yeah.
but
Hmm.
we're still taught to treat it, and it works. The majority of the time it works, which is why we do it. But are there cases that fail? Absolutely. I mean, I myself had an implant placed that failed. Why did that
Yeah.
happen?
So
We
did
don't
I.
know,
Hmm.
you know? So the problem is for some reason when it's taught in school, it's okay if it fails because we were taught by whoever, teachers, and that's okay. This almost, I think it's a result of most people that are physicians or dentists, like type A personalities. We are the type that, like, there was a very well planned out track for us:
Mm.
college, dental school, residency, practice.
Yes.
There is decision making, but not really. You're kind of like, you're just following this road, right?
Yeah. You're
To do
following the herd. You're following the herd a
to
little bit.
to do any of these things, you kind of have to go over here a little bit, and it's a little scarier because no teacher taught you how to do this in school. So, like, is it okay if it doesn't
Yes.
work? And so I find the ones that are in this field are the ones that are okay with, you can call it risk, but essentially it's no more riskier than the filling that you're putting in that you were taught
So
in.
I
That's
would,
kind of, I don't know.
yeah, no, this is a great conversation because, my big thing that I feel or I look at or I kind of experience is that I find that people find it to be the most uncomfortable because we're talking about human behavior, right? Like, I mean, obviously, the mind your mouth. Like, the reason I'm so passionate is that the mind and the human behind the functional side and the behavioral side, a lot of doctors don't want to get in the middle of that anymore, right? Like, I'm not a psychologist. I don't want to get into that. And there is a lot of lack of discipline. Like, I mean, let's be honest, to change human behavior, you need some discipline. And I'm not saying parents, I think it's tough to be disciplined nowadays. I think we live in a society where we get things. I mean, you don't even, if I wait 15 minutes for Uber Eats, my kids,
Yeah.
I'm
Instant
frustrated, right?
vacation. That's what
Yeah,
we're used to.
we're used to that. And this type of work is hard. Right? I mean, it's harder than others. You got to put the time in. You got to believe it, right? You got to
Yeah.
want to change it. Which, I mean, I think we could say that about most things in medicine, but we've created an illusion that we can write you a magic script or we can give you something really quick and it's going to make all your problems go away, which you and I both know that's not
But
true.
I think this is where, like, this is the other thing that we're not trained in school is to talk about failure, but
Hmm.
to also talk about, like, this is not magic, you know?
Mm.
And so I think you have to be able to have sometimes uncomfortable conversations and say, you know, first of all, in my experience, it's generally not one thing that is going to fix everything. Okay. So it's like, yeah, sure, we can expand, but on this scan, I'm also seeing some enlargement of tonsils and adenoids. If those things don't calm down, we may have to look into that too.
Yeah.
Also, make sure you're doing nasal hygiene at home. Like, I can't come home with you and do those things every day. Also, make sure you're going to a therapist, myofunctional therapist. So I think there has to be a very, like, honest conversation, and families that are understanding of this concept and willing to put in the work. I think the problem comes in when we think we can fix everybody
Hmm.
and we tell parents, yeah, we're just going to put in this expander and they're going to sleep better and breathe better and all this, their behavior is going to get better. Cause we know that that's not true for most kids.
Yes, it's true. Yeah.
But
It's an uphill battle.
yeah,
I mean,
but to
you
your
start to
point,
make,
yeah, it's a longer conversation. It's also putting responsibility on the family,
yeah.
which we're not used to. It's like, yeah, come to the dental office, I'll fix your cavities, and then we're good.
Yeah.
But that is in every facet. Like, even my filling, it will fail more likely if we don't change habits at home.
Yeah. Well, the other thing is a lot of this is epigenetics. It is
Yeah.
your parents did it too, or that's another thing. Well, I'm fine. And my big joke is I'm like, are you? Are you really fine?
Yeah. Yeah,
Are
but
you
you know, it
working
also
harder?
it also works the other way because I have families come in because a parent is struggling and they're like, I don't want
Mm,
my children to experience this. And that has been a huge driver for, and sometimes it has been like a kid that's been in my practice for years. And I brought it up and parents are just like, no, we're good. And then all of a sudden, like a parent will diagnose with sleep apnea, or now they have to be on a CPAP. And then at their next visit, they come in and say, remember the thing we were talking about? And I'm like, yeah, I
Yeah.
do, you know?
Yeah.
And I
No,
try to tell them, like, yes, it's still complicated to treat now, but it's much simpler than when you're an adult.
yeah. I'd love to just chat a little bit about this last month or two. I just like it's been I mean, it's always been around. We've always talked about it, but the connection between ADD and ADHD and sleep disordered breathing, it's so fascinating. It makes so much logical sense when you think about it from from the perspective of the breathing. And when just to kind of go back to when we were talking about screenings in school, if I had one mission for next year is like, I just want to continue to cross this bridge because I
Yeah.
think it's huge. And I just would love to get your take and your opinion on it. Like what.
Yeah. So, I mean, we know that when there is sleep disordered breathing or, an obstruction in sleep, that children are not hitting that N3 stage of non-REM sleep, which is when our body really rests, right? It's also like the classic bedwetters. It's because that the hormone to stop us from bedwetting gets released then. It's when everything from the day kind of solidifies, right? And so if we're skipping that and we're just staying in superficial sleep, we're not actually resting. And what we see is kids, their coping mechanism is hyperactivity. So they are essentially bouncing off the walls. And, again, like so many things we've just normalized, like, oh, it's just a 5-year-old boy. They just can't sit still. But you will see if you look at the faces of the one that can't sit still and they're bouncing all over the place versus a 5-year-old that is sitting in your chair, their structure is totally different. And it's
Yeah.
because they're breathing differently and they're sleeping differently. What I have found is now a lot of parents don't want to medicate. So they're not jumping to like, let's give a medication. And this is a big driver for my practice is parents looking for other options. But again, the goal is that we catch these kids before they are in the ADHD category, because as we were saying, like now there's so many factors playing a role. We have to like really rein them in. And if we can catch the early signs, then we don't end up with a kid with full blown ADHD. So for the medicated children, I don't tell parents like, hey, we're going to put the expander and you can get off the medication. No, there's like a whole process that we have to like work backwards now. But yeah, I mean, there's definitely a connection. I'm not saying ADHD and ADD are not a medical diagnosis. They definitely are, but poor sleep on top of that is not going to make these kids function better.
Yeah. Not at
The
all.
issue that I have with schools is, again, it's like curriculum. I find that schools have a lot of red tape, like academic
Academically.
schools,
Yeah.
So like for example, the teachers, they're like not allowed to say anything about ADHD and the nurses as well. So like actually what I have kind of gone to is more parent groups. So like I was recently at a mom church morning meeting and then their parent evening meeting. And I gave a little talk on sleep and I mean, everyone was all ears. It
Really?
was incredible. And so like I've been, I was talking to the people that do my media, social media and stuff. And we were talking about like, what are your goals? And I was like, actually, I think that the population I really need to focus on getting to is directly to the parent.
Yes.
It's like, it's great to educate other professionals, but there's so many things in the way of that where, you're a parent, I'm a parent. If someone's telling me something that can make my kid's life better, I'm going to listen, and they're the ones that need to take action. Like they're the ones that are going to come into your office and going to listen to their time. And a lot of these parents, like the minute you say something about it, they're like, oh, that's what's going on. Like they've already known that there's something not right,
Yeah.
but they just can't identify. And they've brought stuff up to other professionals and they just hit a wall every single time. The thing that I hear a lot is parents saying, you finally like hit the nail on the head, like of
Mm.
what's going on with my child. And no, it's never a quick fix. And it's a process. Expansion takes a year because we do it very slowly. And that's the other thing is, parents will say, well, if I go to the orthodontist, it takes a month. And I'm
Yeah.
like, well, two totally different things here,
Which
you know?
That's a great segue. Let's talk about what's the different type of expansion you're doing and why does it take so much longer?
Yeah. So we do, I mean, the way I explain it to parents, the difference between what I do and what an orthodontist does is I'm looking at everything from an airway function and breathing perspective. Yes, I care about straight teeth, but that is not my primary goal.
Mhm.
So if you go to an orthodontist to evaluate for the need for expansion or braces, they're looking at, can I fit all the teeth in? And how do I make them perfectly straight? I'm looking at, how can I make this airway larger and space for the tongue and expand the nasal passages so we can breathe through our nose.
Yeah.
And as a side effect, you'll probably have teeth in a better position because the more space we make for them while they're in the bone, the more likely they are to come in straight. When teeth are in in the bone, like, I treat a lot of really young kids that have no permanent teeth. They're already developing in the maxilla and the mandible.
Mhm.
And so if they're cramped in there, what do they do when they try to come in? They start turning and then they're coming in sideways. So by expanding kids when they have baby teeth, we're actually putting the permanent teeth in better positioning. So they have plenty of space, so they don't need to turn when they come in. Does that mean that we'll never need braces to straighten in the future?
Um,
No. But again, we make it very clear this round of orthodontics is about making airway space, about making our nasal passages bigger, about making space for our tongue to sit up in the roof of our mouth so we can get out of our airway and promote nasal breathing. And we're going to get better looking teeth.
yeah. Are you using or is there a particular type of expander you're using?
I use fixed expanders, meaning they're glued in the mouth. And I'm glad you brought this up because my expanders have a traditional screw in them.
Mhm.
And this screw in the airway space, and parents will say this, read this a lot, is like, oh, are you using a rapid expander because it has a screw in it?
Mm,
And I'm like, the only thing that makes an expander rapid is if you activate it rapidly.
yeah.
That's it. And if you go to the orthodontist, yes, you'll see that same screw, but they will have you turn it once or twice a day. So that is a quarter to half a millimeter a day. For us, we are doing one turn twice a week. So that is a quarter to half a millimeter in a week. So what that does is it does what's called slow expansion. When we do slow expansion, so when we expand the upper jaw, we're separating two bones, then that allows the new bone to start filling in while we're expanding. So it's much more stable than quickly separating two bones, creating this huge gap in the middle, and then having bone try to fill in.
Yeah.
So because of that, our expansion takes about 6 months. I was telling Melissa I'm out of town right now, but I think I have a sample expander in my backpack.
So good.
But maybe not. I don't know. I was
Now,
just
are you
looking. I don't
using
sit here.
3D printing? Are you
Yeah.
using a 3D
So
printer?
so the type of upper expander that I use is actually I use a lab in Denton, Texas called 5 Star Orthodontics. And they have named the expander that I use the Gandhi expander because now I teach courses and they're like, anyone that wants your expander, it's just easier if they just say your name and I know all the things. So what the Gandhi expander is 3D printed bands that are double banded, meaning on 2 molars. And the reason we do that is it creates a much more stable framework. And so the problem we have with some traditional expanders that are not 3D printed is that the bands that go around the teeth, you can actually like squish them between your fingers because they're very pliable. And so what we see is that when you use those, the teeth flare out versus the actual bone moving.
Mm,
So with a more structured framework, we don't have a lot of that teeth shifting, especially since we're doing it on double bands in the back. The other thing we do is put acrylic on the whole palate. And that's not just to the canines. Most of the time, it's actually to the front teeth, to the maxillary incisors. And that is to create a little bit of what we call like vertical opening. So it almost acts like a bite plate.
yeah.
And that allows the lower jaw to move forward because a lot of times the lower jaw is trapped by the upper teeth and the upper jaw.
Yeah.
So it creates a what's traditionally like a bite plate with the expander, and then the acrylic on the entire palate puts gentle pressure on the actual bone instead of just the pressure being on the teeth. It's to the entire bone. So we get really great even expansion. That's one thing with really young kids. Like I start expansion as young as like 18 months old. If they have first baby molars, we can
Expand.
expand. But what a lot of practitioners struggle with is if you expand too quickly and you don't put even pressure, you can get distortions on little kids really easily.
Okay.
And so the feedback that I get from a lot of myos and people that I work with in the Houston area is that our expansions are really even. And it's because of the design of the expander and how slowly we expand.
Now, are
A
you
lot of our kids will need a lower expander as well, which
yeah.
is not true expansion. That is uprighting teeth. But if we don't do that, then it limits how much we can expand the upper jaw because the teeth will not be biting on each other anymore.
Well, and that's because a lot of people don't realize that the mandible is actually like the victim to the
Yeah.
maxilla. Yeah,
Yeah.
the maxilla is actually the criminal. So you have to sometimes give some support to that maxilla, to the mandible, so that the maxilla can act properly, so it can
Yes.
and do what it
Yes.
needs to do.
Yeah.
Now, are
The
you
other thing we
oh, sorry.
use a lot is the face mask,
I was just gonna
like a
ask about that.
reverse pull.
Okay. Yep.
Okay, so that when I teach my ortho courses, that is the thing practitioners are most scared of using.
Yeah.
But it is, I mean, you want to talk about something that's magic in little kids?
Mm.
That is magic. And we have research that shows that AP movement is easiest between 4 months and 5 years old.
Yeah.
So we really want to be using it on those younger kids. And when the funniest is like, I mean, it looks like an antiquated kind of torture thing,
Yeah.
in front of the face. But when I show it to the parents, I always get the, whoa. And I'm like, your child has no preconceived notion of what this thing is. Like, just let them have their experience. And they are very proud of the fact that they can put the rubber bands on themselves. And I mean, they respond beautifully. And what the thing I tell parents when they're resistant is the only way we can make this movement when they're older is jaw surgery.
Yeah.
So this is way better. So I use it, I mean, all the
the time.
time. And especially, I mean, it's obvious that we need to use it on the kids that had that underbite, like the class 3,
Yeah.
that situation. I have treated so many 3-year-olds and I mean, the results are amazing. It really
What about when they are
is.
8? Can you
I still use it.
Okay.
I use it. But what I tell parents, well, they always want to ask, how long? How long are they wearing this? And I tell them, I said, this is actually the most unpredictable part because some people will respond to it really easily. Others, we're going to be in it, 8 months. So I see them for follow-up and the way I measure forward movement is something called the cosmetic line. It's a Bill Hang. It's like
Yep.
an
Mhm.
orthotropic concept. We take an initial CT on all of our patients. And so I'll look at the posterior airway space, but we're not taking multiple CTs. So clinically, I'm going to look at the cosmetic line and I'm going to look at their facial profile. This nasolabial angle should be acute. So they should have good lip support. And we don't want to do that by only flaring out teeth. We want to do that by bodily movement of the actual upper jaw because we know that's going to give us good facial support, but it's actually going to open our airway. If we just
Mm.
flare teeth around, A, it's not stable. So that's going to rebound. And B, we've done nothing for the airway if we just move teeth. So we have to see actual bony movement is the goal.
Now, are you doing any aligners afterwards if they're older?
Yeah. So it depends on if they're in like mixed dentition, then not just aligners, I'll bracket. I'll
Okay.
do partial brackets. Yeah. So sometimes parents just want it cosmetically. Other times, if the incisors are really flared out, then they're like blocking the canine space. So we just need to consolidate. So yeah, we'll do whatever is needed. And so it's just case by case, so that's step one, right? Like we take our CT, we're looking at tonsils, adenoids. We're screening for tongue and lip tie. We're looking at the space. Do they need just transverse movement? AP movement. What does their vertical space look like? So we're treating structure first.
Yeah.
And then part 2 is function. So
Yeah.
muscle function. So we've talked about the lip tie, tongue tie, mouth breathing, myofunctional, all that stuff during our initial airway consultation. But I tell them, okay, that's going on the back burner a little bit. First, we have to make the structure to support the muscle movement and the breathing. So then towards when we start taking out expanders, then we have 2 in-house myofunctional therapists. So when we take out our bottom expander, they'll meet with the myofunctional therapist, start working on like lip strength, lip closure, things like that. Now we still have the upper expander
Well,
in,
and
so we can't
I
really
did
work on
recently
tongue
tell
stuff.
you that they can start chewing on that munchie.
So the munchie, which we've incorporated and it is working beautifully.
So good, right? Yeah, it's such an
Mhm.
exciting exciting
And
thing.
especially with the kids that come in that are a little more sensory, I give them the munchie before we make the expanders,
Yeah.
and then they're chewing on it like you recommended when parents turn.
Yeah.
So that tool as an adjunct is amazing.
I know. I actually
Um,
just was telling somebody the other day, like, I'm really grateful that I got to hang out with that company and build something of it. But the only reason I talk about that product is because that product is so helpful on so many like ways. Like,
yeah,
in this space, we get hit up a lot for all different types of products, which is great. I'm all about people coming up with things to make things easier
yeah.
for families and patients. But man, when something's good, it's just good, right? And you can use it
Well,
in
and
different
that's the
ways.
thing is like you also have to choose things that are predictably effective
Mhm.
because, well, as a practitioner and business owner, I can't keep 16 different products in my office,
Yeah.
right? Like it just doesn't make sense. But then also from the parent perspective, if I have to choose just a couple of things to give them, I want to choose things that are going to be most effective because if I give them 5 things, they're definitely not going to do them all, you know? And I find the munchie is just like, we know this is going to help. So I'm going to choose this one thing to give you.
Yeah.
And so we've been using that a lot. So yeah, they start kind of the myo segment once we start taking out expanders. And then the second phase is myo release if we need a tongue and lip tie release. And then I see these patients for yearly follow-up. So at our
Mhm.
yearly follow-up, I'm seeing symptom-wise, how are they sleeping? How are they growing? We're updating measurements, making sure we're staying on track. What I find is because it's a process, sometimes we get to the myo tongue tie stuff and parents are like, oh, they look great. Do we really need to do this? And I'm just like, this is like, if we don't do this, this is like not going to work the way we had talked about in all your goals. But again, there's sometimes only so much you can do, right?
Yeah. Fatigue
And
is real too.
fatigue
People
is
get,
a real thing.
yeah.
So, but this is why, like in our ortho program, we made the myo part of the overall, like the lump fee. So
Mm.
that it wasn't like a decision of like, oh, do I want to spend money on this therapy
Yeah.
now? No, it was like, no, guess what? You've already paid for it. Like, we're just going to do
We're
it.
just going to
Right.
do it.
And so that has helped some with the barrier.
Yeah.
But I mean, sometimes I
Well,
see kids for
anytime you
yearly
give
follow up
right, anytime you give
and
people choice, like, it would be
yeah,
I mean, it's kind of like the idea of, like, when you do, I don't know, do a root canal, and it's like telling somebody, "Well, you don't have to do the crown." No, you have to do the crown. The integrity of the root canal, and for any of you guys that don't know, like, you cannot just leave the
leave
temporary.
it.
Yeah, it's gonna break. The stability of it is only so good. You need something really strong to support all the way around it.
But again, those concepts have been around forever. So
Yeah.
it's like easily acceptable. This concept is not
Well, but I think
there.
it's because a lot of us, and not us, obviously not you and me, but like a lot of when I talk to other doctors, it's like this whole idea, like I have to prove it to them still.
Yeah.
Like, and that's slightly exhausting. I personally have shifted very far away from that. But the beginning of my career, thank God I had the Jersey defensiveness in me. I mean, I would take anybody on, right? Like you show me
Yeah.
something, but now I do try a much different approach of more like dipping it in honey. And, if somebody asks me to show them the research, I kind of just laugh. And I said, well, why don't you show me your research about what you're doing that's so great?
Yeah. But you know what's funny is like it will get there. It's like I have an associate currently who does all the ortho stuff with me that I've trained and she's actually planning to open her own practice.
Okay.
And my office manager was like, "Oh my God, are you like worried about it?" And so obviously in the future, I'm going to have to bring on another associate and teach them all the things. And she's like, well, what if this happens again? And I'm like, honestly, the more people that are talking about this
Yeah.
and telling their patients about it, it's just going to make my job easier because right now I have to do all the educating,
Yeah.
whereas the more the field does this, there are a million children that need this treatment. I mean, it's like
Mhm.
every other kid in the practice.
Yes.
The more we're talking about it, the more this becomes standard, the more it's just going to be like, this is just how we practice this. Right now we're just like paving the way and it's a lot of work. So
Well, I
I'm
also
like, the more the
appreciate
better.
Yeah, I actually also really appreciate, and where I wanted to go a little bit was, that's an abundance mindset when we think like that, right? Like the fact that you know that the more you put out good people, they go produce another great practice that only helps the greater cause,
Yeah.
instead of being in this position of like, you know, I always say to people, like, if you live in fear and worried that people are going to leave and things like that, I mean, that's a really tough position to be working from. And one of the things I'm very intrigued by you, and that I always am love to chat with you about, is your business mindset. You're a strong predominant. I mean, you
Thank you.
run a beautiful business. Your office manager is a force to be reckoned with all by herself, right? I mean, and when you talk about your team, you talk about like it's of joy. I mean, unfortunately, I talk to a lot of providers, and when they talk about their team and their, you know, their offices, you can almost feel like a heaviness around them, like it's like
Yeah.
a fatigue. So I love, because a big part of this type of work, I feel, you know, from my end on the consulting side, is about how do you actually implement it? How do you create systems, and how do you create a space that is a bit, you know, it runs like a
Yeah.
well-oiled machine. So let's chat a little bit about that. What makes you
Yeah. And
different as a business? Like, what makes you different?
I think, well, from a like just running a business perspective, like my mind, I'm a systems type person. So for me, like, first of all, in the space that we're in, turnover can be very high, right? And so it can get frustrating as a business owner to reteach and reinvest in people and then they leave. So the more you can systematize something, the easier it is to plug somebody in, right? And so when I teach my courses, that's probably the thing that people enjoy the most is that I have now given them like a recipe book. Like
Mm.
it's very easy to follow. You know, like I just taught a course in Dallas and the lady was like, I've been doing this stuff for years, but I don't have like a system like you do. And I like it makes it so much easier. So that's one thing. That's just the way my mind works, though. I was a math major in college. So, like, I'm a numbers kind of like I have to put
Ah,
things
numbers
in
don't
order.
lie.
Um, the other thing is like I hire based on personality, not on their experience because, well, A, working with children is tough, okay. Like it's not for everybody. I can look at a schedule and think it's going to run smoothly, but it really depends on how the child is that day, right? We can have one loose cannon and the whole day goes sideways. And so you have to be able to hire people that can thrive in that environment and it's not going to weigh them down because they have to do it with a smile on their face and somewhat enjoying it because you'll get burnt out. There's no way you can show up all the time and do this if you don't actually love it. And yeah, I think as a leader, like I have to show up every day energized, ready to do this and believe in the mission. So, like, you really have to I don't think I would be the same leader in the practice if I wasn't doing this type of work because
Mm.
I'm very passionate about this type of work.
So you
And
feel like you have
so,
a clear, like, why, like it gives you a
oh,
really good, like, inspiration.
100%. And I think, like, I know my team understands that. And I always tell people the best way to get your team is invested is to work on their children. And I have treated every single team member that has a child. I have treated every single one. They all needed expansion and tongue ties, all the stuff. And the thing is they saw the difference in their own child and so now when I walk into a room for a consult, they've been with the assistant in the room. The assistant has already told them how amazing this thing
Right,
is
yeah.
and their experience and their things that made it easier for their child.
But you know,
And
Pia,
the fact,
some doctors, it's like really amazing that you say that, because I look at that as like that is the best marketing PR money that you could, your time and spend. One, you're doing it, you're giving back to your staff. But there's like, I've worked, you know, from the consulting side, I have some providers that are like, oh, they look at it like they're taking advantage of the like, like well, I can't just give it away from them. They won't respect it. And I always find that to be such a, like a short mindset, like not a
well, I think when you end up finding, I think this is my calling, but I think when you end up finding the thing that drives you, the money is
secondary.
secondary.
Yeah.
Like people ask me during some of the courses that I teach, like, oh, do you have like a daily production goal? And I'm like, I don't. I show up, the schedule, we try to fill the schedule. That's the goal. But I don't care about the monetary amount
Mm,
because at the end of the day, if I go home with 5 times more, but I've done work that is not inspiring at all,
yeah.
that doesn't make me feel good. I don't want to go back and do that the next day, you
Mm,
know?
yeah.
But if I go to work and I have touched a family or have had, I always tell Kat, who's my practice manager, the days that I love are like the days when I actually have time and I sit and I make like this amazing connection with a parent, you know? And it's like, yeah, I was in that room for 15 extra minutes, but that filled me up for the whole day, you
Because
know? And
you're
it's
in the
like,
business of inspiring people and motivating them, like, right? Getting them
and
to feel.
also like giving parents hope and guidance and so many of them. And it's even tougher these days with our media and there's like so much noise, right? Parents feel lost. They don't trust themselves anymore. They have a gut feeling and they ignore it because someone else said something else or they heard they saw something on their Instagram and they know deep down there's something going on with their child and they need
Mm,
someone to validate that. And unfortunately, most of the time we're not getting validated. People are not saying, you know what, you're right, follow your gut, and so many parents will say, yeah, I knew something was going on, you know? But so like education is probably, if you could ask me what my number one goal is as a practitioner, it's educating. It's not treating, it's educating and letting parents make a decision that feels right for their child and empowering them, like empowering parents to take their child's healthcare into their hands and make a decision that is comfortable and feels right. And sometimes that's not me, that's doing something else. But I don't want parents to choose me because they feel like they have to. I want them to feel like they choose this treatment and this path because they believe it's actually going to help their child.
yeah.
And so that is, and getting back to my team, most of them commute over an hour to my office and they pass like a million dental offices. And, they will say, why do you work here? And they're like, because we believe in what you do. And I believe in what I do. And I lead by example. The other thing is, again, getting back to like more money, more, I only see patients 3 days a week. Could I fill a schedule 5 days a week? Sure. I would be not a happy person and I would not be as energized and enthused to be at work if I had to do it more than 3 days a week. But those 3 days, I give it 2000% and I'm all in. And that is my limit though. Like, yeah, I'll work the occasional fourth day a week. And by the end of that fourth day, I'm like, yeah,
Yeah, not
I,
doing this
I need.
again. When in your career did you make that decision to go to 3 days?
So I brought on associates. I have 2 startup practices and I brought on associates probably what most consultants would say was too early.
Yeah,
But I wanted to take the financial hit to get some of my life back. And also it takes time to find the right people,
of course.
So I cut down to 3 days a week. I want to say 3 years into my startup.
Oh, wow. Okay.
So it's been about 5 years that I've been 3 days a week.
But
The other reason is I started lecturing
I
more.
was just gonna say, it
And
allowed you to go into a new
yeah,
which
so I was taking off Thursday nights and going to a conference and, so I had initially kept my full clinical schedule and then started lecturing and it was too much. I also know to regulate my body, I like to work out every day. I like to have a social life. I have 2 children. I recently got remarried. There are other things in life than work.
Mhm.
And if I spread myself too thin, everything suffers, including myself. So there's got to be a balance. I had an opportunity to expand and work more. And the people that were trying to partner with me were like, well, you could make so much more money. And I'm like, I don't want more money. I want more time.
Time is
So I think
listen,
it's,
but time's a gift that a lot of us, and I'm guilty of it, that, coming into this next year, I mean, I'm excited the business is growing. And of course, having more financial energy allows us to do more things and support more
sure.
people. But also balance is so important to everything. Actually, our biggest mission for next year is that really to truly have function, structure, and good behavior is to live is to be balanced, and the
Yeah.
posturing aspect. I want to just dive in real quick because I love that you brought up, you got remarried, your new husband, and we originally chatted about him a little bit. His profession is one of my favorite, like, parent professions. Like, when a parent comes in, I ask what they do for a living, not because I'm sizing them up financially. I want to, like, know where their mindset is. And he's an engineer, correct?
Yep.
And I love about it. So I'd love to know a little bit, like, what was his take on, like, coming into this space, like, watching you lecture, like, looking at it from a different lens. I'm just curious about that.
Yeah. Well, it's obviously really different. My ex-husband was in the medical space, so
Yeah.
this is like totally different. And, Bradley should probably let me look at his airway as well. But it's totally foreign. But, one thing is that when I was dating, I was like, I want someone that is like as passionate about their work as
Mm.
I am, because I mean, you can't take me anywhere without like an airway conversation popping
Same.
up. And it finds me, I promise. Like, it's
Yeah.
not, So, to him, I mean, he is super, like, loves how invested I am in it, but has no like context about it.
Mm.
And some of it, like, for an engineer to wrap their head around things like therapy, and
Mhm.
it is kind of some of this, like, not numbers
Yeah, it's not systematic.
concept.
And it's interesting because that brings up a really good thing, because usually most engineering minds, they can get behind cause and effect, no problem. Like, but
Yeah.
the therapeutic modality is a foreign modality, which the
Yeah.
myofunctional therapy is the hardest component to the whole program, because it's not always scalable, it's not consistent, and it really, the variable of the human on the other side. And listen, the therapist matters. The more I've been around, I think you and I can
Mhm.
agree on this.
Mhm.
Like, and
Mhm.
again, I'm always mindful from the teaching perspective to the therapist, is that, I'm only at where I'm at now because I've been doing it for so long.
Yeah.
But no one really taught me in the beginning the importance of being a really good coach and being able
Mhm.
to, like, motivate and keep people inspired. I mean, that's a really big part of it. And that's a
Well,
hard
yeah.
variable.
Well, the other thing is, like, when you talk about this therapeutic component and how it's not as measurable, practitioners, like dental practitioners that are more on that engineering mindset,
Yeah.
I find that they struggle with this work more because there is not a number scale. And, like, from an associate standpoint, I've trained all of my associates to screen, but some of my associates are much better at it because they can take a step back and, like, look at, like, read the room, look at the child, like, they don't need a rule for every single thing. And I have other associates that want a rule for every single thing. And I'm like, I can't make a rule for everything. You have to look at the person. And similarly, from a therapeutic standpoint, like, when you're doing therapy with someone, you have to see what their response is and then pivot if you're not getting the outcome. And that's where, like, I think practitioners that are too on the sciencey engineering mindset struggle,
Mm.
because there is some art to this.
There, yeah,
And you
that's a
have
there's a big art to it, right? There's a dance to it. And
Yeah.
there's also a trust factor that you have to be able to just listen to your body. I just came back from one of my retreats. I just came back from South America, and one of the biggest things that I kind of was shown when I was down there was that, in society, in the Western culture, so much, we, like, hierarchy really matters. And
Mhm.
unfortunately, what we have done is, in society, is that we have created the illusion that our brain is the CEO, and it's actually not. It's actually our heart. Our heart is the CEO of our body. Our brain is second in command. And of course, the brain is such an amazing tool, but so many of us we always will default to trusting our brain instead of our gut and our heart. Like, we'll question it, we'll always rely on that. And a lot of times this work is an intuition, right? It's like more of a gut. Like, you
Yeah.
just gotta, something's wrong. I mean, like you said about the parents, you said about moms, you want a mama to come in because she feels it. You want to trust her intuition and her gut.
Yeah.
She's the one. And
Well, and that's, I think, why I excel in this work, is because that has always been how I've lived. Like, my ex-husband always used to say, like, I don't understand how you like know these things before other people. And I'm like, it just
Mm.
feels right. Like it just felt like no one, I didn't like read it somewhere. Like he was a very different mindset where like he is probably the most well-read person I know, but has no like, follow. I'm just doing this because it feels good or
Yeah.
it feels right. Like whenever we hired a nanny for our children, it would be like, oh, this person feels good. Like, I can just feel it.
Yeah.
And there's no like concrete number or a thing. It's just like,
Mhm.
yeah, you gotta have some of that in order to do this work. And to me, that's the differentiating factor.
Yeah, it's you do have to have heart and you have to have soul. I mean, obviously we need to have a really strong practitioner with
Yeah,
a great brain
of course.
and we need systems and we need numbers, but we need more of it. So, let me ask you a question. I mean, obviously you're doing some new stuff with your teaching, you're teaming up and doing some new things, but what's some of your big visions? What are your big plans? I mean, like you're teaching ortho, you're teaching stuff like what are things for us to be, keep an eye out? I mean, I can't wait to, a full, your full programs.
Yeah.
I love all of
Well,
it. You know what I mean?
I have just launched my own podcast called the Pediatric
Oh, you
Breathing
did.
Project. So, yeah, everyone can look out for that and follow that. I think my real goal for the next year is to just really bump up more of the education from parent to parent. Not really like, yes, I love doing the conferences and I love speaking engagements with professionals and want to keep growing on that end. I know we're going to be collaborating on
Yes.
something in the future, but really, from a practice level, we have already streamlined this process, but I'm the type that like keeps pushing and seeing what we can do better. So for a practice level, just like continuing to get this process down so it's like easy for parents to digest in a seamless system. We are playing with a lot of AI things in the office, not so much to make it not personal, but the more we can offload in AI, like the more time we'll get back to actually spend on interpersonal skills versus like nitty gritty,
Yeah.
note taking and things
Hey,
like that. So,
right. AI allows us to become more efficient so we can
yes,
be more human. I just said
exactly.
something. I go, you think I'm taking away the human aspect? I go, AI lets me be more me.
Be
Yeah,
exactly.
I can spend more one-on-one facing time.
Yeah.
Like everything, it's all about balancing. You need, you want to take the good and the bad. You don't want to ever just assume something's really bad. So I love that
Yeah.
you're taking that.
Yeah. So that's like on a practice level. And then obviously, like the podcast is really geared towards parents, but also professionals. So, really, to get myself like just more, not even publicity for my practice, but just to get this information out to more people.
Mm,
And so that's really kind of what I'm working on. And that's on a local level, like in Houston, connecting with more moms groups, from a national level on the podcast, and then doing some more teaching and speaking engagements. And then on a personal level, like really, I have two daughters. They're growing up so
I
quickly.
know.
I'm really just spending as much time with them as possible. And, obviously, like I've only been married for 3 months now. So,
So hang out with
there's
your
there's
husband
a
a little
lot of
bit.
there's a lot of excitement, but also like a new relationship and a new marriage takes work. I mean, the work never ends. But, I would say like keeping the balance because it's always tempting to, ooh, like, let's open up another day or let's do one more thing. And really keeping in mind, like, in order for me to be successful in my profession, I need to be successful in every other part of my life. And to me, happiness is the key to that.
Yeah.
And not like things or outward happiness. It's like truly doing the things that make my heart happy, as cheesy as that sounds. But
No,
it
it doesn't
is,
sound cheesy at all. That's exactly what it's about, right? Happiness is about being fulfilled and feeling like you're filling your cup. And, there's
yeah,
never going to be, it's never going to be all
yeah.
perfect. It's
And
all
I
great.
and I spent the last few years really like cleaning out toxicity in my
Mm,
life. People, things like doing things that I just felt like I needed to or I should do, and keeping people around that, maybe there's a historic relationship or that just were not serving me anymore. And now I feel like moving forward, I really just want to enjoy that work and continue to build on it
Mm.
and surround myself with supportive people and be that support to the people that are around me. And really just like, it's for me and my husband, but it's like every day I'm teaching my girls something.
I was just gonna
And,
say, what you're
and
doing for your
yeah,
daughters, you're teaching them, like, that's the most impressive. I mean, it's great, your husband, but you're really showing your daughters to not accept anything less than being 100% fulfilled.
yeah, that and doing things every day that you love and bring you joy. And, it's not about the end outcome. It's about right now,
Let me ask you a
living in the
question.
moment.
If one of the girls wanted to become a dentist, would you support it, or would you possibly, you know guide them somewhere
I
different?
think it would, I, I would want to know why, what's driving them. My older one, she's in seventh grade. So we'll be applying for high schools in about a year. And she had mentioned there's like a science and engineering high school in Houston. And she brought up like, oh, maybe I want to go there. And I said to her, I said, if you want to go into science and engineering, that's great. But I think it's a better idea to make sure you explore everything first and then decide what you want to do. So I would, if they truly were passionate about like wanting to go into dentistry, yeah. I mean, I don't honestly, what I told them is like, I don't care what they do as long as it makes them happy and as long as they can financially support themselves in whatever capacity that is. So
Yeah.
they know that like once they leave for college, they're not coming back to live with me. They got to make it on their own.
Mm.
And that can be doing whatever. I don't, you don't have to, you live by whatever standard makes you happy,
Yeah.
but you have to be able to sustain yourself.
And
And so,
I asked that question about the dentistry because I always think like, somebody who's in the airway space, like, it can be daunting sometimes that we feel like there's, a lot of resistance from the dental, but do you see hope? And I do. I hope, like,
I do.
yeah,
I
I
do.
do
And I
too.
would say I have other dental friends that are not in this space that are doing traditional dentistry that hate it, that are
Mm,
like,
yeah.
I would never have my child become a dentist. And they're hitting none of this resistance. They're doing the things that are already like known, right?
Yeah. And they
But
hate
to
it.
me, that's the difference of doing something you're inspired by
Mm.
versus not. And it's this is Bradley and I, like, I'm a big journaler. We're like therapy people. And
Ah,
so
that's
a couple of my girlfriends for our wedding, like as part of our wedding gift, gave us this like daily journal for newlywed couples for the first year. And it's like every day there's a question that he answers and I answer. And one of the questions was, if you could do something and money was not a factor professionally, what would you do?
great.
And I literally said, I would do this, what
Same.
I'm doing.
Same.
Maybe I would spend a little more time with each patient, but this is what I would do, hands down. And I don't think I would still be in dentistry if I hadn't found this path
Yeah.
because I was not inspired by dentistry before at all.
That's really a great question. And I really, I do think of that. If I mean, don't get me wrong, I'm grateful that, that I get to make money and support my family and do it. But like, I would be doing exactly what I'm doing. I mean, even now, I would just, yesterday talking to some family and friends, they were like, is Joe, my husband, they're like, is Joe working for a laser company? I was like, yeah. I was like, it makes so much sense because
We're all in.
we're all in. The whole family's all in. Like he was already living it. My sister-in-law works for the business now. And like Michelle works she comes from fashion. Like, but
Yeah.
they saw there was such a purpose to it. And I feel like that's something you and I are very similar on.
Yeah. And, we were talking about how like following the heart is really the way to, kind of
Yeah.
live a fulfilling life. And a couple of things on that is when I teach my courses, I hand out a book called Journey to the Heart. It is a
Mm,
daily meditation book. And that speaks a lot to that. But also, we were talking about how you can't like live and practice from a space of fear because it's
mhm.
limiting. And I would say if I had done that, like not followed this path and from a space of fear, I would have never ended up practicing the way I do because I would have been too afraid to like take that leap, even though it was for my own child. And so I do think like that is the path to a fulfilling, happy life. It's like being able to take a leap or take that next step. But I worry for sometimes our generation that is coming up that they don't have that self, it's not confidence, just like trusting themselves really
Well,
to be able to
trust is a
do
big
that.
issue. I mean, right now we live in a I mean, there's like I think every generation has its own and different scenario and things, and they live in such a different world. But yeah, it's all about it's about trust. It's about the other big thing that I've also have lived this last couple of months is like about forgiveness. Just like
Mm,
not to you got to
yeah,
forgive, right? You can't ask for we're all humans. We all make mistakes. As long as everyone's showing up and doing the best that they can, we're all going to go through ebbs and flows.
yeah,
But that's been this real area of like truly to give people forgiveness. Don't hold on to things, let things flow. And when you can live from that space, life gets
yeah.
easier. Life
Easier.
doesn't get so
Yeah.
hard, right?
Yeah.
You made some choices that were probably around you. People have been like, were
Oh yeah.
hard. Why did you do
Oh
that?
yeah.
And watching you do that. But every time I spoke to you, every time I talked, it was never you giving it was always like you being in your heart. Like you just
Yeah.
be, and I think if we have providers and we have friends and people that lead from that place, we all get to a better destination. And it makes me so grateful to work alongside people like you and be able to do this. I obviously could talk to you for days, and I hope to have you back on, and I hope to be able to come on
Yes.
yours.
Yes.
So
Love
I
to have you.
leave this podcast. I ask everybody a little question of like, what does mind your mouth mean to you?
Oh
Anything.
gosh. Okay.
I do it to everybody. I don't let anybody know. It's become our fun
Um,
little so like when you think of it, what is the first thing
um,
that pops to mind?
I think it is. I don't know. The first thing that comes to my mind is speak with integrity.
Mm,
You know, truly like live and represent and speak your truth
yeah.
is really what I think that means. And
That's
yeah, I don't think you have anyone else's story to tell but your own.
perfect. You couldn't
I'm gonna leave it at that.
yeah, it's perfect. I love it. Well, I can't wait for everyone. Everyone needs to go take her course that is launching. It's launching in the beginning of next year, right? Of 2026.
Yes.
Okay.
Yep.
So
Yep.
when this comes
Yep.
out, we'll have all the show notes in there. And we hope that everybody has a wonderful day. Thank you so much, Pia. Enjoy your family. Thanks so much. Talk to you guys soon.